CMDDA, Canadian Medical Dental Development Association, is a non-profit organization of Canadian physicians, dentists, pharmacists and other allied health professionals. This volunteer organization was founded in 1998. CMDDA's membership of Canadian Tamil medical professionals is proud to protect and promote a society that honors equality, irrespective of race, color or creed, and fair access to economic resources, education and most importantly, access to proper healthcare systems. Our advocacy of access to health initiatives extends beyond our local boundaries, and we are proud to support initiatives at home and our traditional motherland. Medical teams from CMDDA organization took part in north and east part of Sri Lanka to provide medicines and support for the tsunami relief mission during the period of December 2004 to early 2005. The doctors have all volunteered their time and resources to make this endeavor a success. Funds raised from past events of Lights of Healing and numerous blackthorns were contributed to the Jaffna Teaching Hospital cardiac equipments, Save the Heart Project donation towards heart catheterization unit for the Jaffna Teaching Hospital, Tsunami Mission, Alzheimer Day program at Providence Healthcare, Seven Oaks Long-Term Care Homes, Toronto. CMDDA has also partnered with local organizations and contributed to Canadian Cancer Society, Sick Kids Hospital, Amnesty International.
Objective of this year's Lights of Healing fundraising gala is to raise funds in support of two major projects. Markham Storefield Hospital Expansion Project, where your part to contribute is much needed as the Markham Storefield Hospital is expanding with the 100-bed expansion program.
We're building the future.
We're building new bones.
We're building families.
We're building bundles of joy. We're building more space. In 1990, Markham Storefield Hospital opened its doors, ready to serve a region expected to grow to approximately 110,000 people. Now we number over 300,000, and the demand for your hospital services has risen dramatically. So, we're building
area where the new Donor Recognition Center of the Foundation is located. Taking you up along the open staircase, which we encourage you to use, you'll come into the new Diagnostic Imaging Center, located directly above our new emergency. I'd like to now take you into a CT scanner room, which is a very large single room to help those that may feel claustrophobic. It's also designed to ensure good visual contact between the patient and the technician, which we know our patients find very reassuring. There's also a faux skylight to contribute to the feeling of airiness during this stressful procedure. This is one of our brand new 8 operating rooms configured to be used as a regular OR, but also to be used for minimally invasive procedures. Here now, you'll be a part of the 4th floor of the new building, which is dedicated entirely to maternal child
and the pediatric unit of the Jaffna Teaching Hospital, Sri Lanka, where pediatricians in the Jaffna Hospital are trying to renovate the neonatal intensive care unit and ICU. The pediatric unit is urgently in need of equipments like blood gas analyzer and gas meter. These type of equipments is vital to save the life of the newborn. The Jaffna Hospital is the only primary healthcare center for the people of the northern province of Sri Lanka. The pediatric unit is in dire need of equipment critical to the well-being of the newborn babies, especially for families affected by the traumatic events of the Civil War. By supporting these two projects, you could be part of this invaluable project.
Major
specialities and subspecialties available in the country at the time. But the tragedy unfolded following 1983 drastically altered everything. Several medical professionals and professionals from allied medical disciplines left the country seeking secure life. Thus, the services of several units and departments of the hospital were badly curtailed or completely stopped. The pediatric unit was the worst affected since it lost a consultant pediatrician and a senior medical officer during the Indian military attack on the hospital on October 1987, during which 22 hospital staff and more than 80 patients were killed. The pediatric unit was completely paralyzed following this. A permanent pediatrician assumed duties only in 2003, but the situation was not very much improved since the pediatricians appointed here were often transferred within a short period. The situation started improving after 2006. Now, there are 3 consultant pediatricians and a team of 14 medical officers and 18 nurses serving here. But even now, the unit struggles hard to cope up with the situation since the population to be catered is huge. The Jaffna Teaching Hospital caters the entire population of nearly 1 million from the northern province, in which nearly 40% are children. The present pediatric unit has 3 wards and each ward has a bed strength of 40. Further, the unit conducts outpatient clinic every day except on Sundays. The following statistics would paint a clear picture of the present scenario. 12,990 regular patients and 1,770 new patients were seen in the outpatient clinics in 2010 alone. 8,833 regular patients and 1,226 new patients were received during the period of January to July 2011. 8,833 regular patients and 1,226 new patients received the services of the outpatient clinic from January to July 2011. Further, the premature baby unit had received 1,309 admissions in 2010 and 563 babies were admitted to the PBU during the period of January to July 2011. The next most affected area in pediatrics is neonatal services. When the world is moving towards the fetal surgery and fetal medicine, Jaffna Hospital struggles to get even the basic facilities. Further, the PBU had received 1,309 admissions in 2010 and 563 babies were admitted to the PBU during the period of January to July 2011. This is nearly 20% of the children delivered at the Jaffna Teaching Hospital and the suburban hospitals who were transferred here since these hospitals don't have the PBU facility.
Your generous support is greatly appreciated.
Support CMDDA, Canadian Medical Dental Development Association.